My dear colleagues and friends who have joined us in a large number today, we are going to discuss regarding the challenges and solutions of diabetes in our country, in our nation, the state of the nation, and what is the remedy. And to do justice to this subject, we have one of the very young professors of endocrinology, boarding, and who has made waves and impact in the field of diabetes, endocrinology, metabolism, Professor Dr. Adilin Rina Ashirvadam. Dear friends, she is very young, but at a young age, she has made a high impact in the field of endocrinology. Dear friends, she is today the full professor of endocrinology at the Sri Ramachandra Medical College and Research Institute, Porur in Chennai. She had or MBBS training at the famous PhD Institute, DNB from the Southern Railway Hospital, the Makkah of Learning, and following the DM from the Amrita Institute of Medical Sciences in Kochi. Dear friends, at this young age, she has rose to a very high pedestal of honor. She has got about 30 publications and about 10 book chapters in medicine. Rina, with all our heart, soul, and love, we welcome you to this forum of challenges in diabetes and its solutions to do the honor of speaking to all of us today on this very important topic. Before I hand it over to you for the presentation, it's my great honor and pleasure to speak today that what is the importance of learning about diabetes in our country. Now, please, my dear friends, please remember that it is essential to diagnose diabetes early and to provide early aggressive management, which we are not doing. The diabetes is diagnosed late when H1C is high, between 8.9, 9.4, or even sometimes beyond, and we do not control diabetes well in the beginning. There's a paper which is just published from Chicago in the Journal of Diabetes Care, which says the first year treatment matters. And this investigator from the Chicago University has shown in 34,000 patients that those who were controlled very well in the first year got absolutely fabulous results of freedom from complications and great longevity of the life. In contradistinction, where the first year H1C was about 8, 8.5, compared to 6.5, those who got well controlled in the first year, they had lot of complications in the heart, kidney, and also in the feet, and some of them even had early death. Therefore, dear friends, today one of the things that Dr. Rina is going to speak to us will be about the early diagnosis and also effective management. We call it early aggressive management. Say, for example, the first year management, which is to be early and aggressive. And dear friends, to do this, we have in the armamentarium the drugs, the combinations which are fabulous. One of the combinations if the SGLT2 and DPP4, which addresses about 7 out of 8 ominous octet of the differentia. And these drugs today, in an Indian scenario, have become affordable. Needless to mention, they're the most appropriate and they're accessible and available in every nook and corner of the country. Dear friends, at this point, it's my honor and pleasure to hand over Dr. Rina to do the honor. And Indian market is the market for the fixed drug combinations. They provide three advantages. They are convenient, the compliance increases, and the cost comes down. So the combination therapy today, which Professor Rina is going to address, is one of the main things that we listen from her. So dear friends, with this introduction, to say that in the Indian challenges, we have great solutions. We have to pull up our socks and provide, the early diagnosis is feasible today because of the universal screening, which is going to allude to. We have got wonderful ways of finding out what is the prevalence of diabetes, who is diabetic, who is not diabetic. And it is very simple today with the availability of blood sugar estimation. We call today that blood sugar estimation is the fifth vital sign next to pulse, BP, temperature, respiration. Therefore, dear friends, let us gear up to listen to Professor Rina regarding this important topic, the challenges of diabetes in India and its solution. Over to Rina, all is yours.
Thank you, sir, for the very kind introduction. And I thank the Pharma for having me here today. So, what we are going to do in the next 5 or 10 minutes is to look at the challenges and the possible solutions that we have while managing patients with type 2 diabetes, especially in our Indian setup. So, whenever we talk about the challenges, we need to address right from the start until the end, and that is how we will be able to address the problems that our patients with diabetes have. So, whenever we talk about challenges, the challenges what we face starts right at the beginning of diagnosis of type 2 diabetes, where patients do need a lot of education and counseling to understand about diabetes, the risk factors for diabetes, what is life going to be after the time they have been diagnosed to have diabetes, how they should manage the diabetes effectively, as to how to check their blood glucose with the glucometer, how many hospital visits they have to make, and what are the lifestyle changes that they need to incorporate in their day-to-day life. And it doesn't stop with that. We also have challenges from the healthcare provider per se, and where we need to have a more structured way of dealing with patients with type 2 diabetes, giving them the adequate information, giving them the time to think about it, and probably offer them all the diabetes related healthcare services that we will have to offer. And last but not the least is to not just look about the glycemic values, but also to look at the cardiometabolic risk factors, or the look at the patient as a whole sum, where you need to provide a holistic medical care in order to improve the patient's quality of life as well. So the challenges that we face while managing patients with type 2 diabetes necessarily involves the patient, and not just the patient, but also the family that has to be very supportive while we are managing type 2 diabetes as a team. Before going into the possible solutions, the most important step is to identify the possible the barriers that prevent us from achieving the perfect glycemic control, or in achieving the reduction in the diabetes related complications in a given individual. So the barriers could be from the patient end, where we call it as a patient related barriers, which includes a lack of awareness among the patients about diabetes, the diabetes medications, what has to be done, what shouldn't be done, and more importantly, as our Indian patients do pay from their pockets, the huge burden of financial stress also falls on them. And all the more important is the behavioral change that is definitely rewarding in while managing patients with type 2 diabetes. And barriers don't just come from the patient's angle, but also from the community or the society. So barriers like illiteracy, poverty, and more importantly, there are a lot of religious, cultural customs and superstitious beliefs that prevent patients from achieving their target glycemic control, or probably improving their quality of life. And the medical profession, again, also has a barrier from their side. There are a lot of barriers from the healthcare providers, wherein they are many times unable to push themselves more and probably intensify the therapy, taking care of the risk of hypoglycemia, and more importantly, having a infrastructure that really helps patients to achieve glycemic control, and also to look at all the possible complications that can occur due to type 2 diabetes. Now, the second important thing is to manage pre-diabetes. We talked about how we overcome the barriers in terms of diabetes management, but unless we manage pre-diabetes, we would not be in a position to bring down the burden or the load of diabetes. Now, the management of pre-diabetes starts from the very beginning of addressing the risk factors of all the metabolic problems, including obesity, hypertension, dyslipidemia, sedentary lifestyle, smoking, alcohol, and so on and so forth. So, encouraging a very, very good lifestyle change is definitely mandatory for patients who have prediabetes and who aspire to prevent the progression towards type 2 diabetes. And for that, 180 minutes of physical activity per week is very essential, and also accompanied by a good calorie restriction, given the usage and probably the consumption of calories in a given individual. The second most important thing following a lifestyle change would be to look at drugs that can help patients to lose weight, and that is decided based on their diabetes status as well. In patients with prediabetes and obesity, We have fewer drugs as options to be given for the patients. And when they do develop diabetes, we have a huge list of drugs that can help patients achieve their desired weight loss and probably reach their ideal body weight. So drugs like metformin, drugs like GLP-1 analogs, including liraglutide, dulaglutide, and now what we also have in the oral form, semaglutide, also helps patients to lose weight and also improve their glycemic control. And last but not the least is also to consider probable a surgical modality of therapy, which includes the metabolic surgery or bariatric surgery that can help patients achieve their glycemic control as well as the target weight if they fail the lifestyle modifications and pharmacological therapy. Now, how have we changed while managing patients with type 2 diabetes? Gone are the days where we really looked at the values of fasting plasma glucose, postprandial plasma glucose, or maybe HbA1c. Now we have moved away from the glucocentric approach and we are more into a patient centric approach. So we are assessing patients beyond the glycemia, looking at their body weight, looking at their signs of insulin resistance, associated comorbidities like hypertension, dyslipidemia, complications like macrovascular complications, obstructive sleep apnea, and so on. So looking at the patient as a whole helps us to figure out what would really benefit the patient beyond lifestyle modification. So we have quite a lot of drugs that can help us to achieve this benefit for our patients, including the newer DPP4 inhibitors, the SGLT2 inhibitors, which have totally changed the way we were looking at diabetes and reducing the risk of having a cardiovascular event or death. GLP-1 analogs, very good molecules to hold on the process of atherosclerosis and cardiovascular disease. Now, gone are the days when we had a stepwise approach where we put the patient on a drug and allow the drug to fail, give them some time, and then probably intensify the therapy. Early combination therapy has been the strategy now, especially for those with newly diagnosed type 2 diabetes in younger individuals, where we really need to be more aggressive in terms of a beta cell preservation approach so that we also anticipate a beta cell preservation and therefore a diabetes reversal or a remission as well. So a combination therapy with an intensive strategy can help patients to achieve a tight glycemic control, reduce the risk of microvascular and macrovascular complications later on, and also increase the chances of achieving a diabetes remission. Apart from all these modalities of action in terms of managing patients with type 2 diabetes, how else can we really help patients to get to that top level or the achieving the glycemic target? Now, the patient education is a very, very important foundation of achieving a good glycemic control. Now, many times we oversee it or probably under recognize it, but many times when we give that a priority, sit with the patient, sit with his family or her family, and then talk to them about diabetes, how they need to screen their family, what can they do to prevent the rest of the family members getting into this diabetes entire forum is very, very important. And all it requires is just time and it costs nothing. So giving the patient the time for a good education in terms of their diabetes management as well as diabetes prevention for their family is quite important. And when we look at the telemedicine strategies, I'm sure all of you would agree that last couple of years, thanks to the COVID pandemic, that we have been utilizing this underutilized modality, which is the telemedicine, where we were consulting patients online. We were able to educate them about diabetes, educate them about insulin administration, need for insulin, need for diabetes control, and so on. So things have changed significantly in the last couple of decades. We are looking beyond glycemic control, looking at the patient as a whole, and we are looking at and giving much importance to patient education and empowerment so that we are able to achieve a good glycemic control for every given patient with type 2 diabetes as a team. Thank you very much, and let me stop here.
Fabulous presentation, Dr. Rina. Great presentation you have given in a very short time, in about 6 to 7 projections, the entire summary and the outlook regarding the diabetes in India, the state of the nation, and you have also indicated what must be done. how the importance is to early diagnose and the combination therapy. Now, there are few questions which have come from the audience, which questions I have in my stock. I will just like you to kindly answer those questions, and it's a discussion, not answering the question, Dr. Rina. So we'll take up the questions first. Rina, first thing that comes to the mind of everybody who practices diabetes in India, you know that people dub India as the diabetic capital of the world. Rina, you and me have discussed in many forums. There is no pride to be diabetes capital. There is only pride to be diabetes care capital. But nevertheless, there is a high rate of undernutrition in our country. In spite of that, and diabetes is basically a disease which occurs in the affluent countries, in the people who have obesity, we term it diabetes, people who have a very rich lifestyle. But tell me why India, having so much of undernutrition, still has such a high prevalence of diabetes in our country. What are the other factors which is driving it? We don't have obesity, general obesity, but do we have something other type of obesity? Do we have something else which drives diabetes in India to a great extent? Rina, would you kindly answer this question for our audience, please?
That's a very important, relevant question. We often talk about obesity as the major risk factor for the development of prediabetes as well as type 2 diabetes. But as Asian Indians, when you look at it from the diabetes angle, there are two core abnormalities, one being beta cell dysfunction and two being insulin resistance. So either one of this has to go wrong in order to develop type 2 diabetes. In the Western population, we understand that insulin resistance is the major factor that pulls the patient through the phase of type 2 diabetes. Whereas in Asian Indians, especially in the Indian population, we understand that it is the beta cell dysfunction and the poor beta cell mass that drives patients from pre-diabetes to type 2 diabetes, and therefore we are seeing more of diabetes in younger individuals as well as in those who are normal weight individuals. So beta cell mass and the beta cell dysfunction is a critical component for developing diabetes in our Indian population, and that is the reason why, despite being undernourished, despite being low body weight, and despite being normal body weight, our patients do develop type 2 diabetes.
Fabulous answer. Rina, you have answered the question absolutely well, very simply, and provided and provided the real thing that the country needed. Now, Dr. Rina, Professor Rina, the second question that I would like to ask is that no, you have described the challenges, but out of all the challenges, what are the real challenges that confronts us regarding the Indian diabetics, and what are the priorities to meet those challenges? You described very well, but will you kindly prioritize and tell us what are the real challenges, and how we'll come to the next question, how to face them, how to solve them. Over to Rina.
I think the biggest challenge is not to diagnose diabetes. I'm sure that now, with so much of awareness among patients, with so much of social media now helping patients to understand all about diabetes, checking their blood glucose and getting themselves diagnosed with type 2 diabetes has become very easy and very, very accessible for our patients. The biggest challenge, what I would say, is to understand about diabetes. Now, diabetes is not something like a fever where you take some medication for just 5 days, stop it, and then you're feeling all right. That is not so. So there, it involves a lot of change from the patient's perspective. So the patient has to change their lifestyle, has to have a good amount of sleep, reduce stress, eat proper healthy meal on time, watch on the other habits like smoking, alcohol, and more importantly, incorporate physical activity in their daily routine. So lifestyle changes are big challenges, especially in a busy kind of setup. So lifestyle changes are still remain to be the biggest challenge from the patient perspective. From the physician's angle, it becomes very difficult because to monitor the patient, closely follow them up, because we know that type 2 diabetes is a progressive disease, and therefore we need to keep the HbA1cs closely monitored so that we don't allow the patients to get out of control and therefore landing up with diabetes related complication. So these are the two major challenges which I feel that our patients and as healthcare professionals that we face.
Okay. Has westernization played any role in this increasing incidence rate? And what is its prevalence in the Indian population?
I think urbanization has brought in a lot of troubles more than benefits. Though we talk about a lot about preserving our Indian customs and the eating pattern, I think the strong Western influence has increased all the lifestyle diseases, and including diabetes, hypertension, cardiovascular disease, fatty liver, and even stroke. So, whenever we say that the Western influence has caused so many problems, we also need to find out the way out. The major problem about all these urbanization is, one is because of the calorie dense food that is very accessible for anybody. Over a phone call, you are able to get a very good high calorie diet in a matter of just 10 minutes or 15 minutes. So that makes it easily accessible, that's quite tasty, and more importantly, it is relatively inexpensive. So that makes these kind of junk foods more popular and probably more attractive also. The second thing is, it's not just about what you're eating, it's about how much of calories you burn to compensate for the calorie intake. So when you don't have a good physical activity or an exercise regime, whatever calorie you take in gets stored up in the body and is not utilized. So over a period of time, there is a lot of calorie buildup, and that causes obesity, which is a forerunner for all the metabolic diseases. So overall, urbanization has brought in so much of metabolic problems in our country, and that is the reason why we are seeing a lot of younger individuals with type 2 diabetes. Leave alone the 40s and 50s, we are seeing type 2 diabetes even in 30s, 20s, and even 15s. So this is something which we need to sit down and think about it, and probably try to overcome it with the other healthier alternatives.
Very good. I think you have given the correct response, Rina. That is the very important issue, that we have so many challenges in our country, and it is possibly that because of that we have so much of diabetes today in our country. Do you feel, Rina, that Westernization, we call it acculturation, Coca-Colaization, the change of the culture, do you think that this in our country has played an important role in increasing the prevalence of diabetes? This Westernization, has it played an important role in our country?
I think urbanization has brought in a lot of troubles more than benefits. Though we talk about a lot about preserving our Indian customs and the eating pattern, I think the strong Western influence has increased all the lifestyle diseases, and including diabetes, hypertension, cardiovascular disease, fatty liver, and even stroke. So, whenever we say that the Western influence has caused so many problems, and we also need to find out the way out. The major problem about all these urbanization is, one is because of the calorie dense food that is very accessible for anybody. Over a phone call, you are able to get a very good high calorie diet in a matter of just 10 minutes or 15 minutes. So that makes it easily accessible, that's quite tasty, and more importantly, it is relatively inexpensive. So that makes these kind of junk foods more popular and probably more attractive also. The second thing is, it's not just about what you're eating, it's about how much of calories you burn to compensate for the calorie intake. So when you don't have a good physical activity or an exercise regime, whatever calorie you take in gets stored up in the body and is not utilized. So over a period of time, there is a lot of calorie buildup, and that causes obesity, which is a forerunner for all the metabolic diseases. So overall, urbanization has brought in so much of metabolic problems in our country, and that is the reason why we are seeing a lot of younger individuals with type 2 diabetes. Leave alone the 40s and 50s, we are seeing type 2 diabetes even in 30s, 20s, and even 15s. So this is something which we need to sit down and think about it, and probably try to overcome it with the other healthier alternatives.
Now the next question that I would like to ask you, that you know that I want to give importance to Indian diet. Would you like to consider the drugs that we use in our country, anti-diabetic drugs, as an adjunct to the diet? Do you believe that the nutritional therapy, the medical nutrition therapy, or the diet therapy remains at the platform, the foundational management issue? And over that foundation, we should add adjuncts like drugs, like etc. etc. What's your take on this particular concept? The diet not only the beginning of diabetes, even with complications. At every step, the entire continuum is of paramount importance, and drugs can be added on that.
Of course, yes. So the lifestyle changes remain to be the first intervention for patients with type 2 diabetes. And beyond which, once the lifestyle changes fail and is insufficient to achieve the desired glycemic target, then we add on anti-diabetic drugs like metformin as the first line. And sometimes when we have patients who have an established cardiovascular disease or with significant cardiovascular risk factors, we often choose SGLT2 inhibitors or GLP-1 analogs straight away as soon as the lifestyle modifications fail. So the medications, both oral anti-diabetic drugs, insulin, or injectables like GLP-1 analogs, all the anti-diabetic drugs are definitely an adjunct to lifestyle modification, which includes a good, nutritious, low calorie, low carbohydrate, and high protein, high fiber diet, as well as exercise. Without lifestyle modifications, the medications many times may not be able to help us achieve the glycemic target that we would want to achieve for the given individual.
Now, I just want to ask you a very pointed question. How do you find this combination, the fixed drug combination, and the FDCs is India's pride, like many other pride. The other pride, why I'm discussing about the challenges of diabetes in India, the first user of metformin. First pointer that we should start screening at 30 years of age, which America has accepted in 2022. We have many firsts. Now tell me that we are also fast in the fixed drug combinations. Now, how do you find this combination of SGLT2 plus DP4 inhibitors? And will you like to speak few words about it? Because that is very important in the today's parlance.
As I already mentioned, it is a very, very interesting combination that makes sense even from the pathophysiological point of view. Now, if you see that the SGLT2 inhibitors predominantly have an effect on the renal tubules, and it reduces the renal reabsorption of glucose and lets the glucose get passed in the urine. So it also has a secondary benefit in terms of offloading the beta cell from the glucotoxicity, and therefore helps beta cell to perform its function better. When you look at the DPP4 inhibitors, they have a primary mode of action on the beta cell. They improve the insulin secretion by the beta cells, and therefore helps in the other glycemic control. Now, when you bring in two medications that have different mechanisms of action, we are able to address at least 6 to 7 pathophysiological abnormalities that contribute to type 2 diabetes. And more importantly, when you add on a metformin to this combination, you kind of completely cover up or address all the pathological abnormalities that contribute to hyperglycemia in type 2 diabetes. And not just about the benefits, but in terms of the less desired effects, like say, for example, the urinary tract infection that can possibly occur with SGLT2 inhibitors. When you add a DPP4 inhibitor onto SGLT2 inhibitors, we do come across a very, very lesser incidence of genitourinary tract infection. So it's not just about a synergistic benefit, but also it helps each other to nullify the side effects that one can have. So in that way, the combination of SGLT2 inhibitors and DPP4 inhibitors have really been very useful in managing patients with type 2 diabetes beyond glycemic control, and probably to enhance the benefit that both molecules have to offer in terms of reduction of cardiovascular and renal risk also.
Great answer, Professor Rina. So I congratulate you. A word to the public education. If we can make the awareness in our country, the diabetes will be controlled to a great extent. A single sentence answer or comment or message to the nation regarding the public awareness about diabetes, what is the current state and how we can improve it.
I think the current status, from what I would say, has improved dramatically with a lot of social media, public platforms. We have a lot of educational videos that have been put up in the YouTube and in so many other platforms that really help patients to even get information right at their home. They don't have to visit somebody, they don't have to get out of their house to even get to know about what diabetes is all about. But the flaw from that angle is that you have too many information and you won't know which one to really trust and which one to really take it off. So it is definitely important for the general public to understand about diabetes, but also to maybe identify the source of the information, whether it's a very reliable source or probably the one which they shouldn't be very relied upon. So public awareness has improved over a last couple of decades, and I'm sure it would definitely improve even more in the next coming years.
Great, Professor Rina. It was a fabulous discussion session. Your presentation was absolutely great, and you have touched upon all the aspects in 6 to 7 slides. And your discussion was great. My dear friends, let us all give a big thank you. Congratulations to Professor Rina for being with us, enlightening us, and giving us the message regarding the challenges of diabetes in India. Today we have in the armamentarium today wonderful drugs. We have wonderful technique, Professor Rina. As you rightly pointed in your presentation, we have telemedicine. India has the highest teledensity, highest penetration. So taking telemedicine to our advantage, we can also do wonders. Dear friends, thank you very much for joining us. Thanks, Professor Rina, and thank you very much for making our program today great. Thank you. Thank you very much. Bye